is scanning the room. It's just a pile of junk. There's, yeah, nothing. Um, and yeah, there's our paper for reading later. Okay. Okay, let's get this party started. Hopefully this is in a good spot. Okay, so knock knock, I'm Sierra, I'll be your student nurse. Pulling the curtain for privacy, washing my hands, putting on gloves. Can you tell me your name and date of birth?
5/8/1493.
Are you allergic to anything?
Nope.
Okay, I'm going to check that with your wristband. And I have a doctor's order to do a full body assessment on you. Is that okay?
Yes.
Okay. So first I'm going to do your eyes. Do you have any problems seeing?
No.
Have you ever had any eye surgeries at all?
No.
Okay. Does your family have any eye problems?
No.
Okay. So next I'm going to check your eyebrows, your eyelashes, and your eyelids, and those look good. Then I'm going to check your conjunctiva, which is the pinks of your eyes, and then your sclera, which is the whites of your eyes, and everything is moist and looks good. Then I'm going to check your pupils. So I'm going to look in this one, cover this one, and look, cover this one, and look. Okay, and then I'm going to have you look at my finger and then look far away. Okay? And then I'm going to do the 6 ocular movements, so I just need you to follow my pen light. Okay, and then let me know when you see this.
See it. See it. See it.
Okay, and then I need you to read this to me.
I love Barney.
Okay. So then I'm going to check your mouth, nose, and neck. So I'm checking your Zeppelin, checking your nose. Come here. Checking your nose for size, shape, and discharge. So it looks to be of normal size. I don't see any discharge. Checking your sinuses. So this is your frontal and your maxillary. I'm checking the patency of your nasal. So if you can sniff in, okay, and that's patent. Checking your nasal cavity. I don't see any discharge or deviated septums. Checking the inside and outside of your gums. Also checking your teeth and I said inside of your gums. Inside and outside of your lips. And checking your teeth and your gums. I don't see any bleeding. Everything is moist. Everything looks good. Next, I'm going to check your tongue. If you could stick it out for me and move it side to side. All right, perfect. It looks moist and pink. I don't see any lesions. Checking your, I would use a tongue depressor for this if we were actually in a clinical setting, but I don't have any in my house. So open your mouth. I would have you say I would check your oral pharynx, check your tonsils. Uh-oh, you unplugged the tree. That's okay.
We'll plug it back in.
And
We'll plug it back
then
in.
I would check your lymph nodes. I would check your lymph nodes, which are your occipital, your pre-auricular, post-auricular. Then your submandibular. Then your anterior cervical, posterior cervical, and your supraclavicular. Then I would check your, palpate your trachea, inspecting your airway, have you swallow. Okay, and that's good. Next I'm going to check your ears. And so 3 questions about your ears would be, do you have any hearing problems?
Nope.
You ever had any surgery in your ears?
Nope.
Does anyone in your family have hearing problems?
Nope.
Okay, so I'm just going to inspect your ears. your auricles, and they look good. They're evenly distributed. They don't, they're not red, anything like that. Skin's intact. I'm going to pull them up, fold them, push on your tragus, check your mastoid process. So pull, fold, push on your tragus, check your mastoid process. Then I would inspect your ear canal. Normally I would use an otoscope, but I don't have one in my home, so I would check the inner ear canal and your tympanic membrane, and check your inner ear canal and tympanic membrane. And when I do that, I would pull up and back. I need to do, come here, Zeppelin. I need to do the whisper test. Have you close your eyes. Raise your hand on the side you hear the noise at. Okay, and that's good. So then I'm going to do the integumentary and musculoskeletal, I believe. And so your skin is pink, dry, and warm. It's intact. Everything looks good. Checking your skin turgor, it looks good. Don't show any signs of dehydration. Your nails are, I don't see any signs of clubbing. The skin is intact. They're pink. Everything looks good with your nails. So I'm checking capillary refill in your fingers and your toes, and everything looks good. Checking for any edema in your legs, and you don't have any. If you did, the scale would be 1, 2, 3, 4, 2, 4, 6, 8. Checking your arms and legs for any signs of phlebitis, and I don't see any signs of phlebitis. So next I need you to put your hands out, and I'm checking for tremors, contractures, and fasciculations. Then I'm going to palpate your joints, checking for redness, swelling, and pain. Let me know if anything hurts. Any pain? Okay. So then I'm going to do your range of motion. So push your face into my hand. Just sternocleidomastoid, push up. Your trapezius, arms out, push up, push down. Your deltoid, your hand, pull, bicep, push, tricep, pull, bicep, push, tricep. Fingers, don't let me squeeze them together. And squeeze my fingers. Okay? And so your finger strength is good. I'm going to check, push your legs out, push your legs in, checking for abduction, abduction. Then push your feet up, push your feet down, checking your feet and ankle muscles. Pull your legs towards you, push your legs towards me, checking your hamstring and quadriceps. Then I'm going to have you stand up, and I would check you for lordosis, which would be S-shaped spine, kyphosis, which would be a hunch up in the top, and lordosis would be lower. So scoliosis would be the S, kyphosis would be up here, and lordosis would be lower back. And I don't see any issues with that. So I'm going to ask you to walk 3 feet away from me and 3 feet towards me. I'm just checking your gait, and you look steady. So that's good. Zeppelin! Then I'm going to do the Romberg's test, so I'll just have you stand still with your eyes closed. You can't touch the tablet, baby, we're recording. With your hands at your side, and you're not swaying or anything. Oh dear. Here. So, my pizza monster. Okay, so the Romberg's test. You had your eyes closed, you had your hands at your side, you weren't swaying, everything looks good. And I already checked your gait, so I don't need to do that again. I'm pretty sure it asked me to on the paper. Level of consciousness, I already checked in the beginning when I asked you your name and date of birth, and allergies, and then I asked you 3 questions and stuff. We'll count that as your level of consciousness and memory. Come here, Zeppy. So your nerves would be your olfactory is smell. So on occasion, our trusty truck acts funny, very good vehicle anyhow. So olfactory is smell. Optic is sight, so vision, like reading stuff. Oculomotor is eye movement. Trochlear is eye movement, and we tested those with the eye test we did earlier. Trigeminal is sensory, so I would like take a cotton ball and touch your cheeks, and like you'd have to tell me which cheek I was touching. Abducens is also eye movement. Facial nerves would be like smiling, expressions. Vestibulocochlear is hearing, and we assessed that with the whisper test. Glossopharyngeal was gag reflex, and we would have done that earlier with the tongue depressor had I had one. Vagus, it was when you would say ah during that process. If you could say ah for me. Okay, and then accessory is shoulders, and glosso or hypoglossal is tongue, and we already assessed your tongue movement. So that is your 12 cranial nerves. Hi, Zeppelin. And then Babinski test. So I need to do the Babinski test on you, and that's I would take like a sharp object or well, not like sharp, like a pen, and I would firmly go around the outside of your foot. You can't see it, I don't think, on the tablet right now, but I'm checking for your toes to flex. And then so Babinski test. Then I need you to do the finger nose test. So that looks good. And then respiratory. Oh my God, my brain. Respiratory. Have you ever had any problems with breathing?
No.
Have you ever had any surgeries on your lungs?
No.
Does your family have any lung problems?
No.
Okay, so your thorax looks good. The 2-to-1 ratio. I don't see any barrel chest or anything. That looks good. I do believe on the paper it asks for kyphosis, lordosis, and scoliosis again, I think, and we already did that, so we're going to skip that. Your breathing is effortlessly. I'm going to palpate the anterior and posterior. This is the posterior. So I'm palpating posterior and anterior thorax, and then I'm checking for chest excursion. So if you could take a deep breath in for me. Okay, and my hands move symmetrical, so everything looks good there. Chest excursion. So now I'm going to listen to the front and back, listening to your lungs. So I'm going to start in the front, and I have to do this skin to skin. It's probably a little cold, I apologize. So just breathe through your mouth normally. I'm not actually going to ask you to do it, so I don't want you to pass out. So we'll just pretend and I'll do where I'm supposed to do it. But excuse my reach. Side. Okay, and then we'll do the back. Again, skin to skin. So 1. Right here, but under your clothes. And then, okay. Put that back down. Then I'm going to listen to your trachea. So I'll just breathe normally for me. Okay. Then next I'm going to do a cardio assessment. And do you have any heart problems?
Nope.
Have you ever had any heart surgery?
Nope.
Has anyone in your family ever had a heart surgery?
Nope.
Okay, so I would lay you down to check you for jugular vein distension. And if I were to see any jugular vein distension while you're laying down, I would raise the head of the bed 45 degrees and reassess you for jugular vein distension at that point. So now I'm going to look at your precordium, and I don't see any pulsations. So I don't see any pulsations. I can go ahead and palpate, checking for crepitus. So it's like Rice Krispie sounding, like little crunchy things. I don't know if it's weird. So now I'm going to listen to your carotids. When I do that, I'm going to ask you to hold your breath. Okay. Then I'm going to listen to your aortic, or your aorta. So this is aortic, pulmonary, Erb's point, tricuspid, and mitral. Okay. And then after the mitral, this is S1, S2. So S1, S2. Then I need to do your pulses. So the temporal bilaterally, carotid bilaterally, radial bilaterally, radial, popliteal, dorsalis pedis, and posterior tibial. And those are all bilaterally. Then I'm going to do the abdominal assessment, which I need to have you lay down for this. Okay, so did you boys before we did this?
Yes.
Okay, I'm going to ask you to bend your knees up a little bit. I'm assessing your abdomen for size, contour, and symmetry. So is this what your abdomen normally looks like?
Yes.
Okay, everything looks pretty symmetrical to me. I don't see any distension or hernias or anything like that. I would ask you to put your chin to your chest when I check for hernias and stuff, so that looks good. So I'm going to listen to your bowels, and I'm going to listen to all 4 quadrants for 15 seconds, 15 seconds, 15 seconds, 15 seconds. If I didn't hear anything, I would listen to each quadrant for 15 seconds. Come here, Zippy. And so after I listen to your bowel sounds, I'm going to listen to, come here, Zeppelin, listen to your arteries. So aorta, renal, iliac, and your femoral would be down here. Zeppelin. So after I listen to your arteries, I'm going to percuss all 4 quadrants. So percussing them, and then I would palpate all 4 quadrants. And then if you were ticklish, I would take your hand and start the palpating. Is there anything else I can get for you? I have the time.
Nope.
Okay, I think that completes our assessment.